and we're talking to Dr. Sandy Potter, who is the Executive Director for Nashville Cares, C-A-R-E-S, capital C-A-R-E-S. Is that correct, Dr. Cares? Dr. Potter. What does Nashville Cares, C-A-R-E-S, stand for, Dr. Potter?
Okay, it's the Council on AIDS Resources, Education, and Services. And Nashville Cares is the oldest AIDS service organization in the Nashville, Middle Tennessee area. And basically what that means is that we'll be 3 years old in October. We provide social services for people that have been diagnosed with AIDS or ARC, the AIDS-related complex, who have been tested HIV positive, and also support for family members. Right now we have a caseload of around 140, and those individuals are almost equally divided between AIDS, ARC, and HIV positive, with about 20 family members in that number.
What is the relationship, Dr. Potter, between those who have been diagnosed with AIDS and those who have been diagnosed with ARC? Is there any kind of relationship between those two groups as far as Nashville Cares is concerned?
Well, certainly people that have been diagnosed with ARC may or may not move into a diagnosis of AIDS. And so one of the one of the things that we want to do is help to educate those people to keep themselves as healthy as they possibly can.
I think we've already said that education is one of the keys to dealing with AIDS. And perhaps you'd like to give us some information about a recent federal meeting that you attended dealing with AIDS.
I was one of 3 Tennesseans that was invited to Washington at the expense of the Centers for Disease Control in early May to hear more about the America Response to AIDS program. And basically what we were told, we were one of about 150 people at that particular meeting. We were told about what the government hoped to accomplish with this brochure that I believe that you've received in the mail. I have yet to receive my copy. I've got other copies, but...
There was a 6-page brochure.
Yes, indeed. The government has invested about $17 million in this brochure, and this is the first time in the history of this country that an attempt has been made to get a brochure on a health matter to every P.O. box in the country. So this is a massive effort.
Now, do you think that that will be a very, very effective means? What can we do outside of that kind of effort? Because in many instances that brochure might come to the household, but is there any way to make sure that, of course there is no way to make sure that it's read?
No, except on programs like yours to suggest that people do take the time to sit down and, as you say, read through this 6-page brochure. One of the nice things about this brochure is that if people have questions, they can call the federal hotline. That number's listed in the brochure. They can call Nashville Cares at 385-AIDS. They can call Vanderbilt AIDS Project at 322-AIDS. They can call Minority AIDS Outreach, and that number was given earlier in the show. And what we have found is that as various segments of Nashville have received the brochure, our number of calls have increased dramatically with questions. So we have the feeling that people are reading it. That makes us feel good.
Now, what about, that's really on the national level now. Is there anything else that we're doing from a national point of view to deal with this as a disease? I know that there was a recent report that was issued, and perhaps you'd like to give us some information about that.
Well, you're talking about the Presidential Commission report. Yes, I just received earlier today my copy of the chairman's recommendation, Admiral Watkins' recommendation. It's my understanding that the final draft of that report, with all the commissioners' input, will go to the President June 24th. From what I've seen in the papers and from what little time I've had to review that report, it looks like an excellent report. Of course, the commission traveled across the country, heard, I believe, over 500 different people give testimony on AIDS, and I can only hope that the federal government takes those recommendations seriously. One of the recommendations that I'm very interested in is the one having to deal with discrimination, making sure that people that have been diagnosed with AIDS or ARC or have tested HIV positive are not discriminated against through housing, through employment, or other ways.
Now, that seems to be one of the most difficult areas in that entire report out of all of those 600 or so recommendations. How do you make sure that, of course, you can pass a federal law, but now how do you make sure that the word can get across to the American people in reference to this disease?
Well, hopefully through education. The more that we are able to educate people that this is a disease that is not transmitted casually, as Ms. Brown pointed out earlier. We know that there are definite ways that AIDS is transmitted. AIDS is a very difficult disease to get, and if we can educate and bring that fear level down, then perhaps there will be less inclination to discriminate.
Very well. You've also attended a meeting in Atlanta, Georgia, quite recently that has to do with the quilting program. Perhaps you'd like to give us some information about that?
Yes. The NAMES project was started in 1985, and it was started to remember the people that had died of AIDS. And the NAMES project, which, as you indicate, represents a quilt, is now touring the country, and Atlanta was the 10th city in the 20-city tour. And I traveled there last weekend, Memorial Day weekend, and Dr. Haney, I have to tell you, I was never so moved by anything. The quilt at the present time represents 3,500 panels, each panel being 3 by 6 foot and representing an individual. In fact, Nashville Cares sent 9 panels to the quilt. Right now... Each
panel represents a person who has
died of AIDS, yes, sir. And so right now they have about 3,500 panels. It covers approximately 3 football fields, if you can imagine, at present. In October, the tour, I should say, was kicked off last October in Washington. This coming October, the quilt will be returning to Washington. At that time, it should have 10,000 panels and go the entire length of the National Mall. Now, the reason for these efforts is to give a human face to these statistics. You opened the show by saying that we now have 62,000 people that have been diagnosed. 35,000 of those individuals have died. We need to let people know that we are dealing with more than statistics, and I think the quilt does that very eloquently.
Very well. Let me thank you for giving us that information, Doctor, and we'll be back with you following this commercial break.